There are two basic pockets for the breast implant in a breast augmentation. So the breast implant in the breast pocket can be created above or below the muscle. When the pocket is created below the muscle, we typically refer to this as a dual plane pocket. The reason is that in most people, the muscle does not go low enough to cover the entire implant, meaning the lower border of the muscle is released and the very bottom part of the implant is under breast tissue because the muscle does not go that low. So when people talk about being under the muscle, it means that the implant is anywhere from 50 to 90% under the muscle, and that varies depending on a person's body and how big the implant is. But that is an under the muscle or dual plane pocket for the implant. The other option is a subglandular or above the muscle pocket for the implant. And this creates the pocket in front of the pec major muscle. And that's really the main difference. So let's talk about the pros and cons of each. So the pros of an above the muscle breast augmentation are that it is less painful and you do not have to worry about animation deformity or problems with your muscle moving on top of the implant because the muscle isn't involved. The entire operation is done above the muscle. The downside to a subglandular or above the muscle breast augmentation is that the upper pole of the implant, in other words, the top part of the implant that is up here, may have some visible rippling because it's not covered by the muscle, and you may have a contour, or you may be able to see the upper edge of the implant because, again, it is not hidden by a muscle. So that is a subglandular approach to breast augmentation. The other thing I should mention is some people believe that a subglandular approach to a breast augmentation may have a slightly higher capsular contracture rate, but these were older studies and it is hard to extrapolate that data to the present time. People who are great candidates for above the muscle breast augmentations are people who are getting smaller implants, people who have thicker breast tissue already, in other words, their native breast tissue or their soft tissue coverage of the implants is pretty thick to begin with. They also can be good candidates for an above the muscle or subglandular augmentation. And the last group of people is competitive bodybuilders or competitive CrossFit participants, people who are going to have very large and bulky pec major muscles. If they're going to become very thin and have very thick muscles, it can look better to put the implants above the muscle. So those would be sort of the groups of people that may be better off with an above the muscle breast augmentation. The advantages of the under the muscle or the dual plane position are that the implant has better soft tissue coverage. You're less likely to see any rippling on the top of the implant. The transition between the clavicle and the tissue down over the implant is much more natural because it is bridged by the implant, it is bridged by the muscle, and the muscle serves as kind of a ramp to make that upper edge or upper pole of the implant be more camouflaged with a more natural contour. And I find that people who have implants in the dual plane pocket or behind the muscle, they tend to age better, meaning the implants don't seem to stretch out the soft tissue envelope as fast as when the implants are above the muscle. So those are sort of the pros and cons. I say for most women getting a breast augmentation, going under the muscle is probably most appropriate. But if you have thick breast tissue to begin with and you're getting a relatively small implant, and you want to have a very fast, pain-free, or very limited pain recovery, going above the muscle may be a good option for you. Lastly, if you're having a transaxillary augmentation, meaning the implant pocket and the implant are being placed through an incision in your armpit, it has to be under the muscle. There is no way to do a subglandular or above the muscle augmentation through the armpit. To learn more, check out our website where you can upload your photos and concerns as a virtual consult. You can also check out our price estimator to get pricing information for all the various procedures we offer. And finally, if you'd like to have your questions answered on a future podcast or Q&A video session like this, please leave a message on our SpeakPipe. You can go to our blog page and our SpeakPipe is located there. Thanks for listening.